There is an increasing number of fatty liver, cirrhosis, and liver cancer cases. Why is this happening? From the symptoms of the liver disease like a darkening of the face and body to fluid retention in the abdomen, vomiting blood, and reaching a transplant recurring stage is a relatively long process. There is an interval of many years between diagnosing fatty liver with inflammation and cirrhosis and cancer. With the development of modern diagnosis, it is possible to identify liver disorders very early, and in most cases, it is possible to identify the causative factors and take steps to overcome them. This is why proactive care can help to avoid liver failure, liver transplants, and ultimately death. Early fatty liver, cirrhosis, and liver cancer were associated with the chronic alcoholics. Today, liver diseases are common in those who are never touched alcohol and even in the young. When abdominal scans are taken in children, fatty liver is commonly seen. Why is this happening? What can be done to protect the health of the liver? Health tips are not the focus here. Rather, the effort is on providing information that will help to understand the causative factors behind the health condition, measures for early detection, tests to assess the current status of the disease condition, present treatment options in modern medicine with the benefits and limitations. Also, I will try to convey the fundamental relationship of this health condition with the lifestyle and impact of correction of lifestyle has on reversing and preventing recurrence of this health condition. This is why the video may appear long. To help you save time, we have time-stamped the topics in the description below for those who prefer it. Here the focus is on those who would like to make more informed decisions on matters concerning their health. This is important, especially when they would like to avoid surgery and chronic medication with the added effort from their part. It should be remembered that those who are on medication should reduce or stop medicine only under medical supervision. Next, when we have to understand what is the problem with the liver, we should have a basic idea how the liver is made and how it is functioning. Basically, liver is the largest internal organ. It is almost 1.5 to 1.8 kg weight. And it is divided into its smallest unit. It is units are the hepatic cells are arranged in a special way. That is, it is in a hepatic lobules actually. And the main component is hepatocytes. Hepatocytes is the major cells in the liver. And also there is immune system related cells. The specialized cells are there, that is Kupffer cells. Then the liver has the circulation or the blood flow in the liver is also very peculiar. It is distinct from the other organs. Usually the organs have one artery will be having and a vein will be having. One artery and vein. There is artery for oxygenated blood and vein for take it to the heart, the deoxygenated or impure blood. But the particularity of the liver is it has another circulation called the portal circulation. That is a portal vein is coming into the liver. The portal vein is collecting blood from the intestine and all the gastrointestinal tract, the colon, small intestine, stomach, and also from the pancreas and gallbladder and everywhere. From all this blood is coming collected from into the portal vein, and also the spleen that also comes into the liver. And so there is two circulation. One is the clear oxygenated blood from the liver, heart, and also from the digested food absorbed, that is the nutrients collected from the intestine also coming into the liver. So then what is the function of the liver? So this particular circulation pattern and all is to support the functioning of the liver. The liver is the center of metabolism. What we eat is mainly carbohydrate, fat, protein, vitamins, minerals. Those things which is digested in the intestine and then absorbed into the liver actually. Liver is processing all this carbohydrate metabolism. Actually, when it comes to the liver as glucose, carbohydrate digested and the glucose, and it is come to the liver. And liver make, if the excess glucose is stored as a glycogen, that is for the immediate release. That is in the form of a carbohydrate. It's a storage form of carbohydrate. And also if the more than that is only 1 kg, that is the maximum, only 1% of human weight actually is carbohydrate in our body. That only that much, almost a kg carbohydrate only stored in our body. The excess energy, it is stored, if it is from the carb, the glucose is transformed, converted into fat, that is triglycerides, and then sent to fat cells for storage. Next is fat. If there is excess fat, that is triglyceride also, the liver process it in a special format, or directly, if there is not much processing is needed, it is directly sent to the fat cells, and liver support for that. And the protein, the amino acids, the protein we are eating is digested and absorbed in the form of the amino acids. Almost 21 amino acids are there. And with that, the liver produce whatever is needed for the body. That the proteins are made from that. So basically, liver is a production unit, and it also produces cholesterol. The body needs cholesterol for many metabolic activities like making vitamin D, sex hormones, steroid hormones, blood pressure controlling, mineralocorticoid, aldosterone, and even for the cell wall synthesis. So liver is a major producer of the cholesterol also. And also vitamin D, actually the skin produces vitamin D using cholesterol and the ultraviolet rays. But this liver, there's a pro-hormone level, then liver convert into more active 25 dehydro vitamin D. Especially that is more active, and again it is converted by the kidney for the really active form, which is acting on our nucleus to support all the metabolic activities from the genetic side. And also thrombopoietin. Thrombopoietin is a hormone which is actually controlling the production of the platelets, the blood clot formation control is by the platelet. So the production of the platelet depends on thrombopoietin released from the liver, and real production is happening in the bone marrow, but it is controlled by the thrombopoietin produced by the liver. And also there are almost 12 clotting factors. The blood clotting mechanism is very complicated procedure. This platelet is needed, and also there are many clotting factors. That also is produced by the liver. That is why when the liver failure occurs, the bleeding can be a problem. The blood don't clot. That is why the vomiting happens. When the blood is vomited, it is very difficult to control bleeding. then it is also producing angiotensinogen. It's a pro-hormone, and another hormone from the kidney, that is renin, which is acting on this, and it is activated. That is actually controlling our blood pressure control. And also again that will be again that angiotensinogen to angiotensin, and angiotensin is converted into further by the lungs also. So even for the BP mechanism, though all these organs, kidney, liver and lungs is in a collaboration, they are doing all this work. Next major function of the liver is detoxification. Actually, it converts the toxins into non-toxins actually. So, for example, the alcohol, what we consume, the liver converts into energy actually. Alcohol is toxic and it is converted into aldehyde, aldehyde even more toxic, and immediately it is converted into energy forms like acetyl-CoA. That is the function of the liver. And also when we take medicines, these medicines are to be detoxified. Actually, when we take medicine, especially on the oral, when we take the medicine, the problem is actually liver converted into detoxify it. It's making it, the purpose of the medicine is to give effect, to reach the, where is the, if you take a painkiller, you may be having pain on the hands or the leg, it has to reach there. But when we take a tablet, the liver, 80%, 90% of it will be destroyed by the liver. That is actually called a first pass metabolism. First pass, it is passing through the liver. Initially itself, in single pass itself, liver will detoxify a major part. Only those who are escaping that, we are getting the effect actually. So whatever medicine stays, it is a stress for our liver, has to detoxify it. And any other toxins like even the metabolic waste, like even RBCs or any our cells when get old, it has to be destroyed. When the RBCs are destroyed, there will be this hemoglobin. So it has to be converted into an soluble form and to be excreted by the either into the stool or into the urine. So that part also, that is actually bilirubin. Actually, we are checking the bilirubin level and all in the blood when we are sick, and that is actually making the yellowish tint on the eyes and the skin and all in a liver, some type of liver patients. Actually, that function is not happening. It is not excreted. That is why it is that yellow color comes. Next, liver is helping digestion also by making bile. That is some bile fluid. It is making, that liver is making a fluid, and that fluid is actually that storage space is the gallbladder. We get a gallbladder stone and gallbladder polyp and cancer and all. It's actually the problem with the liver actually. When the consistency of the bile, that liquid changes, which is stored in the gallbladder, it can, that is the reason for this actually, for this all gallbladder diseases. Actually, there are almost 500 items every day, every time liver is making according to the need of the body. Next is, what are the diseases which affect the liver? There are different types of them. First is infection. That is, we are always worried of the infections. So there are many types of infections can affect the liver, especially viral infections, hepatitis A, B, C, E, and also many malaria, that is also actually affecting the liver. Malaria parasite is residing in the liver actually, and in between it is released into the blood. And there are other liver flu, so many, the protozoans also, and amoebiasis also can affect. So many infections that can affect. And also toxins. the whatever, even the if you ingest the toxin by the food or on the through the skin, if you are applying on the skin, or through the air also, if a toxin enters the body, liver has to, it will come, when it comes to the liver, it has to detoxify it. So if the detoxification, if the toxin comes, then liver can get damaged, a high amount of toxins. Even medications, it will act as a toxin actually, antibiotics. When we take it, can all damage the liver. And also if the accidental ingestion of pesticides and all, actually in children, usually rat poison, that is very toxic to liver. The children may take it and accidentally eat it. That is the reason for, one of the reason for liver transplant in children, especially in Kerala, my part of the country. Actually, gastroenterologist, liver transplant surgeon was saying, for the children, actually accidental ingestion of the rat poison is the major reason, not this hereditary or metabolic disorders here, which is accidental ingestion of rat poison. Next is nutritional deficiencies can produce severe nutritional deficiencies, and sometimes those who drastic weight reduction without the fasting and many drastic way of weight reduction and body shaping and all can lead to liver damage. That is because of the many vitamin deficiencies, especially choline is one of the most important vitamin needed for the liver. And when you are low calorie diet and when you are depriving enough nutrition for the body, and it is affecting first liver, because liver is the producer or everything. The liver has to meet the demand of all the body, so it will be first affecting the nutritional deficiencies, also will be affecting the liver. Next is slow progressing disease which is affecting the liver. That is most important is alcoholic fatty liver disease. And there is a non-alcoholic fatty liver disease variety also is there. Here also we should, that is fatty liver occurring in non-alcoholics, those who are not taking alcohol. That is, most of these patients will be usually obese also. Actually, the non-alcoholic fatty liver disease, the culprit is either the carbohydrate overeating, the cereals and the sweets, and even this fructose. That is mainly, if you are nowadays you are using so much of fruit juice, even the fructose in the fruit juice itself can create problem, because it's not like glucose. Actually, it is a strain for the liver, the fructose and both are sugars. But when you are eating fruits and all, or even there is honey contains high content of fructose, and also fructose syrup. Nowadays we are fermented, this corn and all is fermented and is made into artificial honey and high fructose syrup. This is added in all our bakery items and sweet items and all. So it's also a strain for the liver. Actually, the sugar, the common sugar that is called dextrose, actually chemically, that contain one molecule of glucose and one molecule of fructose. But when we are eating rice or the wheat, the carbohydrate in the form of the glucose, that is not that stressing for the liver, because it can be directly used into energy. But the fructose has to be converted into some mechanism has to be there to make it into an energy form. It is more difficult. So large quantity of fructose consumption in the form of fruits or in the form of fruit juice or this corn syrup, that is high fructose corn syrup, or even the regular sugar, it can create problem for the liver. That is the reason for actually this non-alcoholic fatty liver disease. And the alcohol is a carbohydrate only. It's another form of carbohydrate. Alcohol is also a carbohydrate which can be used, which is used as an energy format, but it is in a more smaller and this thing. This is in another form. That's all. And also excess fat in the intake of more fried items and also nuts. Nuts are very high in fat. Actually, we are not seeing the fat in the nuts. Actually, most of the nuts like cashew nut, badam, pista, all contains almost around 40% at least fat. These are all actually creating excess in quantity is the reason for the non-alcoholic fatty liver. Then the next level of disease is hepatitis. Alcoholic steatohepatitis, non-alcoholic steatohepatitis, ASH and NASH. This is actually in that condition. In most of the people, this will just as a fatty liver, it will continue like that. There will be accumulation of fat in the liver. But in NASH or ASH, the hepatocytes get damaged and the liver enzymes also start rising. The liver, that is the sign of actually when we do LFT and all the liver enzyme SGOT, SGPT, or increasing means that is the hepatitis is there. That is a progressive, that is actually damaging. When the damage is happening in a higher and higher level, the fibrosis happens and then goes to the cirrhosis. And cirrhosis of the liver. Cirrhosis means that normally the healthy active, this production unit, it's a chemical factory, the small chemical factories. And the hepatocytes is the real workers there. They are getting diminished and replaced by the fibrous tissue. They are inert. So that is the reason for stringing this fibrosis and stringing of the liver. And also there is inflammation. Inflammation means it can lead to cancer also. There can be DNA changes happening inside because of this continuous insult by the toxins, continuous stress given by the toxins, continuous stress given by the nutritional deficiency. When a new hepatocyte is damaged, the liver has to make new hepatocyte. So to make a new hepatocyte, it needs nutrients. When there is a deficiency of any of these, almost 57 nutrients as needed, and if there is any nutrient is deficient, it can affect the liver badly. And even this one of the this production that is what I said calling, that is only recently it is approved as a vitamin actually. Before it was not considered as a vitamin. Now choline is considered as a vitamin. It has very important role in many metabolic process, and even the deficiency in a pregnant lady can get damage to the brain and the spinal cord, and this neural tube defect can occur. Next is drugs. Many drugs like antibiotics, many antibiotics, especially when you use 2, 3, 4 antibiotics together in this TB, tuberculosis, or this chemotherapy medicines, even steroids, and this cardiac medicine like amiodarone, this methotrexate, which is usually used for the psoriasis and this arthritis patients, and many cardiac medicine like diltiazem, tetracycline, many antibiotics, and tamoxifen, that is a hormonal anti-cancer medicine and for the infertility and all it is used. Those medicines also can give a chronic liver disease and liver problems. Then chronic infections like hepatitis A, B. Hepatitis A usually subside by itself and go away. But hepatitis B and C can carry on like that, and it continues to inflammation and create more problem. Out of this, hepatitis C is more problematic to make a liver cancer also. Then autoimmune disease. There is all the autoimmune disease, there will be a familial component and also a lifestyle component. Familial one type of autoimmune liver disease is very fast, acute, and fulminant type. The other type is low progressing. There are people who in the family getting a liver failure at the age of 40, 50, 60, enroll in the family, but they are not alcohol, they are not using alcohol, and those people comes under this category usually. This is low progressive autoimmune disease, and also that is can be hepatitis sort of thing can occur, and also the cholangitis, that is the bile duct, that is which is the liver is producing a fluid for the digestive fluid and it is excreting through that, and that fluid is flowing through the this bile duct. If the bile duct is affected by the autoimmune disease, it's called cholangitis. It has this autoimmune disease are mainly because due to there are recently microbial mold is one of the reason, and also the gluten. That is the most proved component is gluten. That is one of the protein in the wheat preparation center. That is why many diseases we are advising gluten-free diet. And next comes to cancer. Cancer can be a liver cancer which is developed in the liver itself, or it can be a metastasis especially from the GIT, that is gastrointestinal tract. If there is a colon cancer, definitely the first secondary can occur in the lymph nodes and then to the liver. Lymph node, initially it's all drained into the lymph nodes and then comes to the whole blood which is circulating in the gastrointestinal tract. The vein is collecting and putting it in the liver. So there is a chance, and all other anywhere in the body, anyway blood is coming to liver, and they are supposed to remove all the abnormal cells and everything. So one of the major site for metastasis from other cancers also. Then the gallbladder is actually a part of it. It's a storage space for the bile, and it can have stones or polyp or cancer. And also the diseases of the pancreas, like diabetes, type 2 diabetes, or most of the patients with type 2 diabetes can have chronic pancreatitis also. This also will have an impact on the liver also. And other GIT, gastrointestinal tract diseases like gastritis, colitis, IBD, IBS and all. And there is a mechanism called leaky gut. When there is an inflammation means there is an ulceration, inflammation. There the gut is leaking. Actually, when we know that, when the skin is abrasion is there, the fluid will ooze out. So just like that, there is a mucous membrane break is there. The bacteria can get inside the blood and they are going directly into the liver. So that is a mechanism for many of these cholangitis and autoimmune disease also. Then newer developments and the newer understanding shows that this leaky gut, that is even the undigested food and the bacteria, which is there is a huge biotome in the many bacteria, microbes in the intestine. They also get inside, and the undigested food also get inside. So that is all making a burden on the liver. That is can give an impact on the liver. Next is metabolic syndrome. That is obesity, diabetes, dyslipidemia, hypertension. All these have an impact on the liver because it's all actually the first impact actually before all these things manifest. The impact is on the liver. All the burden is actually taken by the liver because of the obesity, excess, all the eating habits, excess food. That is all actually the liver is taking the burden. That is why the fatty liver is one of the initial manifestation in all this metabolic syndrome. If you are checking for the fatty liver or liver problems in an obese patient, definitely there will be. And diabetic, dyslipidemia, that is high cholesterol, triglyceride, definitely the liver also will be affected. And also the hypertensive patients. And also those patients with the snoring and sleep apnea, they'll be having definitely a fatty liver and maybe early stage of liver fibrosis. Then many of the nutritional deficiencies and excess deficiencies like a choline or any vitamins or the minerals, and also the excess carbohydrate and fat, that also act as a toxin actually. And again, the toxins inside the food like food additives, color, preservatives, even the pesticide and weedicide residues, all will give having an impact on the liver also. When we take medication for these diseases like this lifestyle disease, diabetes, hypertension, taking 3-4 medicines for these things also. So that also actually adding the workload of the liver. Even the insulin. We are actually, when for the diabetic patient, type 2 diabetes patient, there's no insulin deficiency, but you are injecting insulin or giving medicines to produce, asking the pancreas to make more insulin. This insulin is actually burdening the liver. Actually, insulin has to be detoxified by the liver. And the liver, when the insulin is come, it is also detoxified. So when there is so much of insulin, that insulin resistance, liver is finding it difficult to detoxify also. So there are multiple mechanisms making our lifestyle, it's all comes under lifestyle disease. So our lifestyle is actually making the liver sick. Next, when we come to the diagnosis, that is what are the symptoms? Actually, initially there will be not much symptoms. If you have fatty liver or even the initial stages of liver cirrhosis, you will not be much symptomatic at all. Only tiredness or mild abdominal pain, especially in the upper right upper quadrant. And this another sign is actually you can look for a protruding tummy. So it is maybe directly proportional to the fatty liver also. So there is excess fat accumulating in the intestine, the inside the abdomen and the abdominal wall, and the obesity. That will be the only initial symptoms actually. And when we go into the investigations, if you have any of the tiredness, abdominal pain, or protruding tummy, or you are obese, you can check the blood test, liver function test. It includes almost, depends on the lab, there may be 10 or 12 tests will be there. It includes SGOT, SGPT, so many other things. And it will give you whether it is hepatitis, what are the problems, even the jaundice, what type of liver affection, and all we can find from the different elevation or decrease or increase of the different parameters in this test. And also lately there is fibro test, that is to assess the liver fibrosis level and the prognosis. What will be the status of the patient by the fibro. That also a series of biochemical markers. And there are inflammatory markers like CRP, hsCRP, ESR, that also give an idea about the liver inflammation also. Then autoimmune markers also there. There are LKM, that is liver kidney microsomes antibody. That is that is to find out autoimmune liver disease, which is progressing to fatty liver or cirrhosis. And also that anti-transglutaminase, that is another enzyme needed for the liver, and the antibodies against that, and also antimicrosomal antibody AMA. And for the cancer, there are cancer markers also, especially alpha fetoprotein, which is considered as one of the tumor marker for the liver disease itself. But if it's a secondary, the other colon cancer marker like CEA, we can check whether it is, if the colon cancer it is metastasizing, or ovarian cancer it is metastasizing to by CA125 and all. Next is the scans actually. The most easiest and the most economical is the ultrasound scan that can give an idea about the not only the liver and the gallbladder, any stone is there, or fatty liver is there, stone is there, or even the other abdominal organs also, an ultrasound examination of the abdomen. And also this fibroscan, that is a specialized scan to see the elasticity of the liver, to assess it and to see how much is affected. Actually, previously for diagnosis, we are considering the biopsies are considering as the gold standard. But even for the fibrosis, liver fibrosis and all, so we can do, because it's an invasive procedure and it can give complications, especially in a liver patient. So now we can avoid that by liver biopsy and all for a diagnosis. We can do an ultrasound of fibroscan, and we can repeat it also. Biopsy, you cannot repeat it according to you, but fibroscan is not having any side effects, so you can repeat it also. So that also will give clear idea about what is the progression about. Then CT, MRI directed biopsy and all is there. But next comes for the MRCP, magnetic resonance cholangio, pancreatography is there, ERCP is there. I'm not going into the details of those things. That is not coming under this thing. Then and also PET scan for the cancer. So whole body PET scan, then we can clearly say from where the origin, and it is the things we can say. When we come to the treatment, there is if it is an infection, there is definitely antimicrobial agents we can use. But even the antimicrobial agents can be harmful to the liver also, because the liver has to detoxify it. That is the problem. For the liver disease, when the liver is at sick, if you add medications, that is a problem. So it is always better not to become sick too much. So you correct your lifestyle. Almost all these diseases comes under lifestyle disease, unless it is an infection. Even infection can be because of you are getting infection because of your bad lifestyle, and your immune system is weak with nutritional deficiency or overloaded toxin. So lifestyle correction is the answer. The first line of management is the lifestyle correction. Other than this antibiotic for the infection and all, then next only medicine is the bile acid actually. When ursodeoxycholic acid is there, that is actually for the stasis and also for the gallbladder stone it can be used, but it is useful, but it can also damage the liver if it is for a long time use and all. Next, when it comes to portal hypertension and the liver is not allowing the blood to pass to the vena cava, the portal hypertension comes. Then there are some if the bleeding comes, the varicose veins can happen in the esophagus, and it can start bleeding. And also when the liver is sick, either the clotting, the bleeding mechanisms can be altered, then the bleeding happens. Then you can do the cauterization, banding, and some procedures are there. But previously and all, there was actually, it is when the varicose veins comes seen in the esophagus itself by endoscopy, do the banding and all. But actually, it's a protective mechanism. The blood cannot flow through the liver. into the area is blocked. So the body is finding out other way to reach the circulation through this newer forming blood vessels. It is not like the varicose veins in this esophagus is not like the varicose vein in the leg, and it's a bypass actually. Actually, it is not correct to do the block the bypass by injecting this sclerosing agent or banding, etc., because you are blocking even the newfound way also. Only if it is needed to block or sclerosis in your laser treatment is needed when there is a bleeding. When there is a bleeding, we have to stop the bleeding. For some things, we can use the cauterization and all. Otherwise, it is not that ideal when you think logically, but usually the gastroenterologist and all is doing that as a preventive, but it is when you think it is the mechanism, and you go into the deep depth of the mechanism why it is happening, it's better not to do. If there is no bleeding, don't interfere with that. Only to try to rebuild the liver and make it more reduce the portal hypertension by giving enough nutrient and reduce toxins actually. Next is to treat the other comorbidities like diabetes, hypertension, all these things. Actually, liver is getting more and more sick because of the medication taken for those diseases also. So that also actually increasing the workload of the liver. So you cannot escape from a liver problem by taking medication. And finally, if the liver fails, there is no artificial liver actually till there are under consideration and under development. They're trying to develop a dialysis machine like for the liver also to remove the toxins. The protein metabolism toxin like ammonia and all is accumulating in the blood. So trying to develop some sort of artificial liver and at least to remove the toxins, but it is not only under consideration and under trial and error. And next is actually currently if the liver fails, only the solution is a liver transplant. That itself is a major risky procedure because almost for the donor also, if the live donor is used, it is a risky procedure for the donor. If donating a kidney is not that risky, but liver donation is a risky procedure because almost 60 to 70% of the donor's liver is removed and given for the recipient. So that also can be considered only for the very close and loved ones only for them. You are sacrificing, they are taking a risk for your life itself for the other person. And when this cadaver, actually when we think of the dead person's liver also, you should remember that it is also when the person is not dead actually, it is when the patient's heart is beating. So that is also, there are so many ethical and other concerns also. Only the brain death is happened, the heart is beating, liver is live, then only you can transplant. So it is, we should always remember that is even the live donor or the dead donor, that there is so much complications is there. And also if you accept a liver also, you have to take a heavy dose of immunosuppressants. That itself can create infection. You are making the recipient prone for the infections and cancer, etc. So the best solution is actually try to keep your liver healthy. And how we can keep the liver healthy is only by leading a healthy life. When we consider about the solution, the only solution is to protect the liver by eating correctly and also avoiding toxins in the food, and also this excess food, even the carbohydrate, fat you are taking is actually harmful for the liver. So reduce, if you are obese or if you have a protruding tummy, abdominal obesity, you reduce on your food, that is calorie, and see that you are avoiding, if you want, especially if you see that you have fatty liver and in the family there is fatty liver or liver disease, see that you are reducing the toxins entering into your body through the food, like color, preservatives, tastemakers, and also by the cosmetics. That is also very important. This hair color, hair dye, even the other body lotions, everything is getting absorbed and the burden of the toxin is on the liver. So anything this other than a nutrient is a toxin. Liver considers it a toxin, and also even the nutrient in excess quantity is a toxin. So try to correct the lifestyle and do the exercise. If you have excess fat in your body, try to reduce the fat or burn out the fat with the exercise. That is the only solution. And if a person who is already on so many diseases and if you are taking so much of medicines like having diabetes, hypertension, etc., they may not be able to come out of a disease and reduce the medicine by self. So if you are on medicine, it is not, you will not be able to come out of medication and the disease by your own. In such cases, you need a clinically supported lifestyle correction. In brief, 1. All liver diseases from fatty liver, cirrhosis, liver failure to liver cancer are considered lifestyle diseases. 2. With the current modern diagnostics, it is possible to identify such diseases at an early stage and identify the associated lifestyle issues and correct them to protect the liver. 3. Gallbladder stones, polyps, cancer, etc. are caused by fatty liver and poor liver health. The variations in bile fluid made by the liver to aid digestion is the cause of gallbladder stones, polyps, gallbladder cancer, etc. 4th, excessive toxins, lack and excess of nutrients are the main cause of liver disease. The liver identifies as a toxin anything that is not a nutrient, even medicines and also an excess of nutrients. Biological agents like virus, bacteria, etc., alcohol, medicines, excess of fats and carbohydrates, chemicals like artificial tastemakers, preservatives, weedicides and pesticide residues, etc. All of these can result in damage to liver cells. 5. Initially, only relatively weak symptoms like fatigue, abdominal gas, and small abdominal pain are felt. Only after liver damage has advanced, we see symptoms like facial darkening, edema, ascites, vomiting blood, severe discomfort, and mental paranoia. 6th, when blood tests and ultrasound scan help diagnose early stage disease of liver and gallbladder, the best and simplest approach is to identify the lifestyle related anomalies and immediately take steps to correct them. 7. The liver has the primary responsibility of detoxifying all toxins that enter the body either through food, air, or even the skin by metabolizing. 8th, when the liver becomes diseased, it is most important to reduce the workload of the liver and allow it to rest. This can be done by preventing toxin entry into the body, helping expel toxin already accumulated in the body, and simultaneously providing adequate nutrients to help replace damaged liver cells with healthy new cells. 9. The liver sees almost all medicines as toxins. Medicines increase the workload of the liver. This is why medicines often negatively affect the health of the liver. 10. Those taking medications for lifestyle diseases like diabetes, hypertension, cardiovascular disease, etc., should understand that they had to correct their lifestyle to overcome both their lifestyle disorders and the need for medication to protect the liver from fatty liver, cirrhosis, and cancer. This information should assist you to understand and prevent lifestyle diseases, to help detect them at the earliest when present, and correct the lifestyle to reverse them. Also, it can be understood why medication and surgery cannot reverse such disease conditions. It is not the lack of medication or surgery that create the disease in the first place. This is why it is essential to understand how suitable lifestyle changes can only reverse these diseases and, more importantly, prevent their recurrence. Before any invasive interventions or surgery, it is essential to understand the underlying cause of the disease. What purpose does the surgery serve? The on-table and post-operative risks associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders, who are usually those who need to support the patient and share the consequences as well. Very often, there is poor understanding on whether the surgery provides recovery or relief and whether the surgery prevents recurrence. Nowadays, health insurance is very common. This provides an opportunity to undergo surgeries without fear of any financial stress. This consumerist outlook guides many to be opportunistic and take advantage of the surgical options available primarily on the financial availability angle rather than on an overall picture. This is where the statistics that often provide us the huge percentage of unnecessary surgeries done on unknowing patients deserves maximum attention. Before every surgical intervention, the patient or guardian actually signs the document acknowledging the possibility of undesired consequences or even deaths from the intervention. This document of acceptance is to be read and understood before fixing a date for any surgical intervention. One should understand that any surgery is constrained by chronic lifestyle diseases, and if the advantage of reversing them with the lifestyle modulation before deciding on need for surgical intervention is considered carefully, it will be possible to avoid the need for a majority of surgical interventions. We need to be proactive in health and not wait for the disease conditions to reach a stage where we lose hope of the ability to actively reverse our health problems with self-motivated lifestyle correction. Otherwise, we will have to remain an outside observer in the effort to recover health. Very often, never getting a clue of what the numerous healthcare partners are actually doing for your health. Very often, the core of improving body composition, metabolism, and immunity are never possible when you remain an outside observer, and this is what I hope will be the game changer for those who want health over conventional patient care. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Lifecarecentre, Thevara, Kochi. I focus on lifestyle modulation with the clinical support, minimizing medication and surgical interventions for lifestyle diseases. The focus was on understanding the effects of modern pharmaceutical drugs, surgical interventions and physiotherapy on immunity. Based on the knowledge on the functioning of the immune system, developed nutrient formulas and body conditioning protocol named Oxyflex for optimizing circulation, stabilizing neuronal, hormonal and immune activities. Optimized nutrition along with the Oxyflex is the foundation of the cell activation protocol, a clinically supported and supervised lifestyle modulation method for optimizing health, delay aging process, prevention and reversal of lifestyle diseases like diabetes, hypertension, heart disease, allergy, asthma, cancer, autoimmune diseases like thyroiditis, arthritis, psoriasis, etc., thereby reducing the need for medication and surgical intervention. Next, let us understand what is clinically supported and supervised lifestyle correction. Step 1 in this approach is to understand body composition and fatty tissue status to help determine desired body composition. Step 2 is to conduct laboratory tests to evaluate the health status of the organs of the body like heart, liver, kidney, pancreas, etc. Status of the system like circulatory, immunity, endocrine, metabolic, etc. and the compatibility status of food consumed or generally available. Step 3 is to identify what lifestyle modulations can help achieve the desired body composition. Patient-specific conditions will help decide on the effort at optimizing nutrition, physical activity, and the prevention of toxin accumulation. The focus is to create an enabling environment for the cells of the body to regain and retain optimum metabolic activities. When lifestyle modulations restores and retain optimized circulation, metabolic activities, hormone balance, immunity and body composition, most lifestyle disorders can be overcome. When those who have been on medication for a long time and who have not reached the stage of irreversible organ failure are ready to modulate lifestyle to benefit from nutrition and help the repair and replacement of sick cells, protection from exposure to toxins, improved circulation through controlled physical activity, it is possible to prevent or overcome the vast majority of lifestyle diseases like diabetes, hypertension, angina, cardiovascular disease, allergies, asthma, arthritis, autoimmune diseases, cancer, etc. This also helps to avoid the need for medication and surgeries. Next, I'll give you a few examples of liver problems which is corrected with the clinically supported lifestyle correction. This is one is the young male. He's 25 years and 173 centimeters height and 82 kg his weight. Actually, he came to me not for a liver problem actually. His main problem was Tourette syndrome actually. That is some sort of involuntary muscle contraction on the face. And so that is from birth, and he's not able to communicate with the people, and it is affecting his career and everything. So that is the reason for actually he came for clinically supported lifestyle correction. Before the clinically starting, we checked for and also he had understood that he is having a fatty liver. So it is having fatty liver grade 2, and his liver enzymes was also high. SGPT, SGOT and all was high. It was SGPT was 61 and SGOT 52 and all. And he is slightly obese also. His fat percentage was actually almost 30%. He's an IT professional, and his almost 80 kg weight also is there. So after starting, I'm not going into the details actually. Within the 8th day itself, actually we recheck in the 8th day, and 8th day itself his liver parameters came down to normal, and also he had a very high insulin level. He's on the insulin resistance also. That also the liver parameters and insulin level also, pancreatic parameters also corrected within a week itself actually. And after usually we repeat abdominal scan is done on the 30th day. By the time he was having grade 2 fatty liver and enzymes. Actually it is a NASH, non-alcoholic. He is not alcoholic, so it's a non-alcoholic hepatitis, steatohepatitis, and the fatty liver is gone by 30 days, by 90 days. And the liver enzymes corrected within 8th day itself actually. So when you correct the lifestyle, it's so easy to reverse liver problems. That's what I want to tell you with this example. Next is also an young man. He's 30 years. His height is 151 centimeters and his weight is 56 kg. Actually, he's having a fatty liver, grade 1, and also gallbladder polyp of 6 into 4 centimeters when we started. He's also come not for a liver problem alone. He knows that he's having liver problem, but his main concern was he's having keloid type of skin lesions all over the body, especially the keloids are appearing. That is a fibrosis of the skin actually, skin fibrosis actually, that is keloids. And without it is not on, usually keloids come on wound or anything, but it is getting the keloids all over the body without any injury or anything. There's a major, usually it comes from the chest bone actually, in front of the chest, but even the back and everywhere small lesions were there. That was his major concern. And here his enzymes was not that high, it is only slightly elevated. His CPG was only 55 and so. But he's having that liver polyp, gallbladder polyp also. And this person by the 90 days actually, again we have checked that within 8th day itself the liver enzymes got corrected and the fatty liver is gone by 30th day. The gallbladder polyp was not gone, but it was reduced in size. It was 6 centimeters size earlier, the millimeter, not gallbladder polyp was 6 millimeter, not centimeter, sorry. And it has come down to 4.5 millimeter. It may take some more time, maybe 6 months or 9 months. We had to follow it up also. And he's considering his other problems also has reduced by 30 days. He has almost the small this fibrosis and this thing is gone already. But this patient, it is more important because he's having a skin fibrosis also. So there is a chance for going to liver fibrosis. Maybe it is connected. The first patient also, I forgot to tell you that his main problem was tics actually. By 90 days, he is able to communicate properly. Well, only when he is conscious or he is worried, only he is getting the tics actually. By 90 days, he is almost, it's not cleared. Actually, it was from birth, it is this involuntary movements of the actually jaws actually. It was there. He was not even within 4 or 5 ticks will come within a. He cannot complete a sentence. In the initial phase, he was not able to complete a single sentence without 2-3 ticks actually. But sometimes he may be able to talk even 5 minutes without any ticks. That was the end result by the 90th day. So it is correcting the liver, fatty liver, but also the clinically supported lifestyle correction can be even able to come out of come out of the person who is having this Tourette syndrome from the birth itself, and also for this sort of keloid lesions also, keloid, especially idiopathic keloid type of lesions on the skin. Another patient, she's a lady, 55 years, 155 centimeters and 57 kg. She's has a non-diabetic, hypertensive, and dyslipidemia is there, neuropathy is there, gastric problem is there, acidity and all is there. And she came actually not for any of this, and also fatty liver. And they also know all this workout was done outside. And she came for actually when she had a chest pain, severe chest pain. She was admitted in a hospital and they have advised to do an angiogram. She was worried about the angiogram. She don't want to go for a surgery. So she came to for this clinically supported lifestyle correction. And even she had the time also she is having pain. And her blood reports also showed an acute myocardial infarction evidence because her troponin level was so high, around more than 7,783 actually. And her liver enzymes and SGPT, SGOT and all was high. And even the bilirubin was high, protein high, albumin high. So much of, and also she's having, I'm not going to all the other because the patients will be having so many problems we cannot discuss. I'm talking only on point of the liver disease. Actually she was diabetic and hypertension and she was taking medication for that, and even with the medicine and insulin, so her SbA1c were 9 also. And hypertension also, even with the medicine, her BP was 140, 90, 150, 90 and all. Anyway, the liver enzymes, actually we didn't check the liver enzymes in the 8th day. By 15th day, liver enzymes has come down. And actually for the troponin level, their major problem was myocardial infarction. The troponin level by the 8th day, it has come down to 1075. It is more than 7,700 something, and to come down to that. And 15th day, it has come down to 158, and by 30th day, troponin level reached normal. And the patient was symptom-free, and the chest pain and all gone by the first week itself actually. And within 1 or 2 days itself, the chest pain and all disappeared. And the BP, sugar control also, her SbA1c came down from 9 to 8.6 in the 8th day, and by 90th day, her SbA1c came down to 6.2 without any medicine, after stopping all the diabetic medicine, and her SbA1c also came down. So that's what I wanted to convey, that the liver will be getting corrected when the medicines are withdrawn. Actually, when the clinically supported lifestyle correction, we stop the diabetic medicine in the first day itself. If the patient is type 2 diabetes, this patient is type 2 diabetes and her insulin level was 28, it's very high. and blood sugar level was 309 when we are starting. But within 24 to 48 hours, the blood sugar reached normal. And even the insulin level within 8th or 15th day, insulin level also will reach normal. There's another patient who is 69 years and 161 centimeters and 75 kg weight. So obesity is there, diabetes, thyroid disease, dyslipidemia, gastrointestinal problems, and depression, and multiple problems is having. And he was on insulin and psychiatric medicines. And his ultrasound scans shows not only fatty liver, he's having a renal stone. Left kidney was having a 6 into 5 millimeter stone, and also BPH was there, by benign prostatic hypertrophy. And he was on so many medicines for diabetes, hypertension, and also for the psychiatric disorder, lamitogrigine. That's he was taking almost 300 100 morning and 200 evening, and also aripiprazole. That is another psychiatric medicine, and also many other medicine. And those patients who are having especially psychiatric medicines and many other medicines will also have the liver problem, this problem, type of problems. Actually, he is also his liver enzymes came down to normal. Here, as usual, for the lifestyle clinically supported lifestyle correction, we stopped all the diabetic medicines initially itself. And he had so many other problems also. Liver, GFR was so, kidney was affected, not only liver, so many systems were affected. And his liver enzymes came to normal, and also on the 90th day, his fatty liver was gone. The prostatomegaly was also, prostate size was reduced from 37 cc to 34 cc. And the kidney, the renal stone, that was 6 into 5 centimeters to 3.3 millimeters. So that means it will be passed, it will go off actually. So it is multiple benefits actually with the clinically supported lifestyle correction. When you are coming out of medication itself, within a month, we diabetic medicine, if it is type 2, on the first day itself we can stop. All the other medicines, most probably within a month we can come out of the medicine. So naturally, with the correct nutrition and correct exercise and weight reduction also, it is there will be significant weight reduction also. He was 75 kg and he has came down to 65 kg. His weight reduction is comparatively low. We usually, with 90 days, we get almost 20% weight reduction for those patients who is needed. All the other patients also, I didn't mention about the weight reduction part. All these patients also getting at least 15 to 20% weight reduction in 3 months. That is also part of this correction actually. One more example I'll tell you. This person actually came to me for the liver disease itself actually. And he is diabetic for the last 20 years and hypertension for the 15 years. He is on medication for all those things. And even when we come, his not only liver, actually he was done ultrasound scan and fibro scan actually. The fibro scan showed stage 4 liver fibrosis. That is the very serious problem. That is the reason he came here. And he is having other problems like many other problems also, prostate problem, skin problem, BPH is there, varicose vein is there, kidney problem is his GFR has come down, CKD2 level 2 is there, and so that was the situation. Here also we stopped the diabetic medicines on the first day itself, and all the medications come down. And he had here his bilirubin, all the liver function tests has come down to Not in the 8th day, it is only came down. Actually, his 95 was SGPT and 69 was the SGOT. It has come down to SGPT. In the 8th day, it came down to 80 and SGOT come down to 53. And by the 15th day also, it was actually not came down. Only by the 30th day, liver enzymes came down to normal. And after that, the 60th day and 90th day, it was staying normal. Basically, what I want to convey is this all comes under lifestyle diseases. Even the heart disease or the MI or diabetes, hypertension, kidney disease, liver disease, even the psychiatric disease. When we take medicine, you are putting your liver under risk because the first itself, all the medicines are coming into the liver, and if you try to treat your liver disease with medicines, so it is not possible. You had to give rest to the liver. So all these patients, I'm taking few examples. There are so many people because fatty liver and cirrhosis is the most common accompanying element actually in all these, almost all the clinically supported lifestyle correction patients. The focus of clinically supervised lifestyle modulation is not on the symptoms. Focus is on the lifestyle parameters to be corrected to set right, the undesired variations in the body composition, hormone activity, circulation, immune status, etc., which are at the root of one or more lifestyle diseases. This explains why patient can simultaneously get relief from multiple diseases, multiple symptoms, and multiple discomforts. We should understand that the basis of recovery from diseases is the self-healing power of the immune system. The goal is to create the optimal environment for the immune system to stimulate this self-healing power. Everyone should try to self-modulate their lifestyle to optimize health. When this is not possible, or when suffering from a serious condition, or when suffering from multiple disorders, or taking chronic medication, or suffering from the ill effects of chronic medications, or when the surgery is under consideration, the need for clinically supported and supervised lifestyle modulation becomes necessary. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatments with the emphasis on the benefits of lifestyle correction from the website and YouTube playlist. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding the symptoms, current diagnostic methods, and treatments along with the benefits and side effects. Practical aspect of the lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical, and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.